Hi guys, it's your girl Kachi and I'm here with another amazing health education. Okay, I like that. I think that's what I'll be calling it. Okay, so today we'll be talking about something really interesting. By the way, if this is your first time seeing me, you're very welcome. And if you're returning watcher and you haven't subscribed, kindly subscribe now. Click the red button. Okay, let's grow as a family. You're welcome to this beautiful catchy lifestyle channel. Today we're talking about something very interesting. This topic is something that is usually neglected, okay, and it's affecting people but they don't know. Yeah, that is the problem with this particular topic. It has a subtle effect on us that we are not aware of. So you want to know so that you take, precaution and prevent this, because it is super preventable just by your actions. What we're going to talk about is something that affects a lot of people. This is a woman thing. If you might want to watch, because you're also going to be married, you have a wife, and you want to tell them, oh, see the consequence of this, let's not do it and stuff. And we're talking about drinking alcohol in pregnancy. We know a lot of people feel like it doesn't have any downside, doesn't have any problem, but there is a problem. Drinking alcohol in pregnancy, actually, the WHO said do not drink any drug because they don't know the quantity that will affect your baby. It could cause, if you drink alcohol while you're pregnant, it could cause you to have a miscarriage. I'm going to talk about the one that is very subtle, that is happening but we don't know. Okay, so but this drinking of alcohol could cause you to have miscarriage, could cause you to have a stillbirth, premature baby. It could also cause the baby to have some developmental difficulties. Now, there is a name that they call this. It's called fetal alcoholic spectrum disorder. I'm going to explain this in a minute, but first of all, let's talk about the quantity thing. Now, nobody has a clear say on whether it's 1 cup that will cause it, or 2 cups, or one whole bottle, or whether it's gin, red wine, or whatever. It's just alcohol, and it affects these children. A glass of red wine here and there might not do anything, yeah, but they are saying do not drink at all. That is what is in the books. So why am I saying this? There are people that drink alcohol in pregnancy in large quantities. You don't want to do that. Regardless of whether you think it affects your child or not, do not do that. It is dangerous, because what if it affects your child? And I'm going to tell you how it affects these children. What if it affects your child? What if it, like, now because of the alcohol you drank, your child is now having one form of disability? Because it gets to that extent. And the thing about this is that Nigerians are not aware of this disability that happens as a result of taking too much alcohol, or as a result of taking alcohol. We don't know. Don't drink alcohol. Why? The doctor said so. Why? I don't know. Because nobody has come out and be like, oh, I drank alcohol and this happened to me. Or I drank alcohol and my child is doing like this. I drank alcohol. Nobody has said it. Nobody, I said, most people in Nigeria don't link alcohol to a particular thing. Now I'm going to show you the problems that taking alcohol in pregnancy causes to children. I've already said what those other ones. Now I'm going to give you this picture. Look at this picture here. This is how people that have fetal alcoholic spectrum disorder looks. When you take alcohol in a quantity that could give this disorder to your child is going to be looking like this. The child will not have this. If you see this hole inside here now, that place will be flat. The lips of that child will be very tiny, will be small. Then the eyes will be wide spread, like this. My eye that is here, and it will start from here. Then their ear, their face will be, like, they're just going to have these different features. Now, this is what we see. Why I said it's subtle is a spectrum. Just like autism. I'm going to talk about autism in one of my videos, my next video. Just like autism is a spectrum, meaning for this child, it could be severe. Then for another child, it could be just small. Then for another child, it could be in between. So we don't have like, oh, because I took 1 glass of alcohol, bam, this is how your child is. No. It has grades. It grows from 0 to 10. So your child could have that disability of 2. Another child will have 6. Another child will have 10. How does this happen? Because the child's liver is not fully formed while they are in the womb, okay? When the mother takes this alcohol, the alcohol goes through the placenta into the child's system. And you know what digests the alcohol is the liver. The child's liver is immature, so it cannot digest it. Now, this alcohol will start affecting the brain. Will start affecting the organs in that child. Some of them, when they are born, they start having kidney problem, liver problem. Aside from all these features, they start having hearing problem. Their sight is also affected. You know, some of them have speech problem. Some of them have reasoning problem. They don't understand things well. They can't, learn very well, learning disability. They have all of this problem. Now, you may not see all of this problem in one child, okay? You would see this and this will not be there. You will see this and this will not be there. If you're taking plenty alcohol in pregnancy, just understand that you're going to subject your child to any of these things. One of it will be there. Either they're having hearing problem, or they're having eye problem, or they are not in class, they are not assimilating well, or they are not talking well, or they are dull, or they are slow, or they are hyper. Okay, so fetal alcoholic spectrum disorder have 3 levels. The worst of it is the FAS, which is the fetal alcoholic syndrome. This one is when it's severe. It affects the central nervous system. It affects a whole lot of organs. Like, it's severe. Even if you see this child, you know there's something wrong with this child. That is the severe part. Then we have the alcohol-related neurodevelopmental disorder. Then we have the alcohol-related birth defect. This one is when it affects a whole lot of organs. Then we have the
neurobehavioral disorder associated with prenatal alcohol exposure.
Once you get married and you know that you guys are working to have a baby, then stop taking alcohol. It's not until it is tested that, yay, 2 lines, I'm pregnant, then you stop. Once you start, planning to stop taking alcohol. Just like you take folic acid while you're trying to get pregnant, before you even get pregnant. As you're working on trying to get pregnant, stop taking alcohol, please. It's very, very important, because I will say it again. This could be subtle, or it could be very severe. Doctors will not even know what is wrong with your child. Because it's mild, nobody can link it to alcohol, especially in Nigeria, because Nigerians, this is, how some things are common. My last video about AS, marrying AS, made me realize that in some African countries, they don't even know about sickle cell. Like, they don't have information about it. So some things are endemic are common in an environment and not common in another environment. Okay, some things people are more aware in this environment and not aware in this environment. The thing is, please, whatever it is, they said alcohol does it. Avoid alcohol. The treatment for this condition, there is no cure for it. It doesn't have a cure. This is a lifelong thing. So that is why you want to take it serious. Once the child has this, it is lifelong. There's no cure for it. There's no one treatment, because it's a cluster of conditions. So you treat this, you treat this, you treat that. So you treat symptomatically. Another thing you could do is what we call protective factors. It includes diagnosing this child earlier than 6 years of age of this child. Another thing is to, show love to this child, reduce violence, create a nurturing environment for this child, because some of them, depends on the severity, they could be special needs children. And so now you have to look for school where you put them. They will need special education and special care. So all these things, because you took alcohol in pregnancy, please just leave alcohol alone. Once you are you want to get pregnant, leave alcohol. You know how they'll say, do not engage in premarital sex. Then they'll not be like, but if you have to, use a condom. So do not take alcohol in pregnancy. But if you say you are coconut head and you will not hear, small dose. But the best is don't take at all. That is the best. This thing has issues. You're not going to use what you're drinking to come and subject your children to life of torment. Like, they're going to have issues and issues. As they're growing, their kidney will be failing, or liver will be failing. One thing or the other. The things, because you see, once it gets wrong inside the womb, as your child is there and you get it wrong, it will keep manifesting and just keep growing like that. This is something that people don't know. We all know that, alcohol affects, or the doctor said we should not take alcohol. But do you know why and how bad it can get? It can actually get bad. So there's some people that will be like, oh, I take alcohol in my pregnancy, nothing happens. Sis, you don't know that something is happening because we don't have, it's not like temperature that you put the thermometer and it will read 30 degrees. No, this is a growth problem. Sometimes the child will not meet the developmental milestone. When he's supposed to stand, you'll be sitting. When he's supposed to run, you'll be crawling. When all these things. And it's better. Prevention is better than cure. Pregnancy in a woman, if you give birth to 5 children, it's 5 times. We know it's 9 months times 5. But out of your 35 years, bring her 4 years and say you're not going to drink alcohol. Bring her 5 years and say you're not going to drink alcohol for the good of your child. I think it's something we should all, work towards. As you're looking at me now, you like alcohol. Just put in your mind that once I get pregnant, I'm not taking any alcohol. Now, some people don't even know that they're pregnant, and then they've taken alcohol. Don't fret, okay? The error has been done. Now that you found that, stop taking alcohol. Please. The world is hard for people without disabilities. Let's not bring more people. Let's not bring people that will come and be, having disabilities. Even for you, it's going to be hard. It's going to be hard on you. It's not just the child, it will be hard on you. It will also be hard on you. So avoid alcohol when you're pregnant. So with this, we come to the end of this video. If you have gotten anything and you like this video, please like it. Actually click the button. It helps push this video so that more people will watch, okay? Click that like button and click the red button, subscribe to the channel, and click the notification bell so that when I post another video, you're going to be notified. It's free. You've already watched. You can do all of these things. You're not paying anything extra, okay? So please go ahead, subscribe, like, and click the notification bell, and I'll see you in my next video where I'll be giving another health education. See you in my next video. Bye.